230. So that's better.
We consistently would get about 2,000 traumas a year, but beginning in 2016, we did see almost a 40% spike. Over the past, I would say maybe 2-3 months, we've also seen a spike in the number of assault rifle injuries. It does take an emotional toll in terms of the healthcare providers. They're seeing very traumatic events happen. There's an emotional and a mental well-being that you also need to have, and this can definitely take a toll on that too. Mainly North Lawndale, South Lawndale or Little Village, Austin and Garfield Park, and occasionally Humboldt Park. South beyond the 55, Brighton Park area. So when you talk about just the cost of trauma to society, I think there's a few things to understand. Trauma patients, especially people in the community, tend to be younger, the more productive members of society. You can categorize trauma costs into 3 separate categories as a whole. One is the immediate costs, having the hospital care, having the operations, having the CAT scans, and that's kind of the upfront costs. Intermediate cost, and that's the cost of the patients with the disabilities. So that would be the cost of the rehabilitation, the cost of the skilled nursing facilities, the medical cost of having someone that may potentially have a disability. By taking such a young patient and potentially making them disabled and making them not be as productive, they're not going to be paying as much in taxes. They're not going to be contributing as much to society in terms of the work that they're doing. And that cost is kind of a hidden cost that affects everyone. A lot of people may think of this as this isn't my neighborhood and this isn't my problem, but ultimately it affects all of us. The immediate cost and the cost of continued health care for patients who get injured, and either it's being covered at the state level, eventually that comes from tax dollars. If a patient is insured, that cost is being covered by the insurance company, which can translate into higher premiums for everyone. If they don't have any source of insurance or funding, that generally means that the healthcare providers need to take the cost, and that ends up boosting the cost of healthcare for everybody else. Another cost that may be associated with the trauma as a whole is that a lot of times the victims may be parents, and that basically produces 2 issues. One is that it may eliminate the primary provider of income for the family. And that basically requires more reliance on the community and maybe more reliance on the state. The other thing that it does is by eliminating potentially or producing problems with the parents, they may not be as available to do parenting. The family members are also affected in that the children may not be able to aspire to their highest potential because they may now have a lot of limited emotional resources or financial resources because their parents have succumbed to some sort of injury because of trauma.